Assalamu alaikum, dear students. Hope you are healthy and hearty. Welcome to NIEVS Homeschool. This is Fatema Sabrin, Shikha, Assistant Teacher of National Ideal English Version School Morning Shift. Today I am going to take Home Science class for the students of Class 8 on the topic of Chapter 5, Lesson 1 to 5. I am repeating, today our topic is Chapter 5, Lesson 1 to 5, and we'll read the text. And students, this is our third lecture. I'm repeating, this is our third lecture. Students, for today's class, take your home science book. We are going to read the text and chapter 5. So let's start. Chapter 5, name awareness of disease. The environment in which we live is full of germs. This cannot be seen through open eyes. Some of these are very harmful. These germs enter to our body through food, skin, respiration, and others. But we do not become sick instantly as we have resistance power to fight against them. But with poor resistance, we get sick with fever, cough, diarrhea, and others. This chapter deals with the methods of dealing with disease and also the immunization, vaccine, and injection. Now come to lesson 1, common childhood disease. Children can be attacked by different contagious diseases. The common causes of these are low birth weight, premature birth, food deficiency, or maternal sickness during prenatal period. No breastfeeding after birth. The first milk contains colostrum, which creates resistance power to fight against disease. No complementary diets after 6 months. No timely preventive vaccine or injection. So for these, children are used to suffer in various kinds of diseases. Now come to page number 37. The above reasons are responsible for making the child weak and sick. The following are the contagious childhood diseases. First one is fever. Everybody has some idea about fever. We all know that the normal body temperature is 98.4 degrees Fahrenheit, but the temperature of a baby's body is 99 degrees Fahrenheit. When the temperature rises above this, it is considered as fever. There can be many causes of fever like infection, allergy, etc. So we know that the normal temperature of human body is 98.4 degrees Fahrenheit and a baby's body temperature is 99 degrees Fahrenheit. The following steps should be followed for low-grade fever. Using light cotton dress, light and airy room, sponge of head and body, serving light liquid food, especially saline water, food, juice, soap, and milk, following physician's advice. Now, duties to be done in high fever. So here we learn how we have to control our fever or what we have to do in the time of fever, high fever. High fever is common among the children of 1 to 5 years. It may rise up to 105 degrees Fahrenheit, which is very harmful for brain and nerve. So if any child is suffering 105 degrees Fahrenheit, that means in fever, it is very harmful for brain and nerve. The symptoms of high fever are convulsion and abnormal appearance, increase in the rate of respiration and pulse, become senseless, frequent vomiting, and diarrhea. The following steps should be taken. Frequent sponge of the body till fever comes down. The body should be made dry with cotton cloths. Next, in case of 104 degrees Fahrenheit to 105 degrees Fahrenheit temperature, a shower is necessary to bring down the temperature by 2 or 3 degrees. So when the temperature is 104 degrees Fahrenheit to 105 degrees Fahrenheit, it is necessary to take a shower so that the temperature may be in 2 or 3 degrees down. Next one, arrangement for free air and light should be made. Light cotton dress is the ideal. Consultation with the physician is immediate. So if we see that the situation is getting worse, we have to take the necessary steps talking with the physician. Diet in fever. In fever, the metabolic rate increases. Nerve and tissues wear off, and there is more need of protein and other food elements. Fish, chicken, milk with bread, soup, soft rice, light lentil can be served for easy digestion. In fever, there is huge loss of water, sodium, potassium through sweating, and the power of resistance decreases. So there is a need for sufficient liquid. We can say fruit juice, vegetable soup, sherbet, coconut water, saline, etc., as well as nutritious food. Now we'll learn about lesson 2, diarrhea. Diarrhea is waterborne disease. In diarrhea, food is not properly absorbed and digested, for which it comes out rapidly with stool. The symptoms of diarrhea are the following. So first one is frequent loose motion, nausea and vomiting. The front leg goes down, sunken eyes. So if we find these symptoms in a baby, so we have to understand that the baby is going through the disease diarrhea. And another symptoms are tantrums, dryness of tongue and lip, loss of weight. In severe condition, child becomes senseless. So these are the symptoms also of diarrhea. Steps to be taken. So we have to take this kind of steps for the disease diarrhea. The child should be served oral saline immediately to stop dehydration. ORS should be continued as long as the patient goes to toilet. Continue breastfeeding with normal food. Liquid food like fruit juice, rice, saline, and lemonade can be served. In case of severe dehydration, the child should be hospitalized. So we have to take in this type of steps while a baby is going through diarrhea. Next, oral dehydration saline, ORS. In diarrhea, huge amount of watery substance with potassium bicarbonate, sodium chloride, and glucose is discharged. Saline compensates this requirement. Saline contains sodium chloride, sodium nitrate, potassium chloride, glucose, and pure water. Saline can be prepared easily at home. So here are the ingredients and the other side quantity. We have to take molasses or sugar, salt, pure water to make saline, and molasses or sugar in a handful quantity. Salt will be a pinch and pure water will be half liter, that means 500 milliliter. The ingredients will help making ORS at home. The prepared saline should be finished by 12 hours. The main goal is to stop dehydration. How to use ORS? Breastfeeding will continue. Physician's advice is necessary. Saline should be given each time when the patient goes to toilet. The process will be continued even if the patient vomits. Now come to page number 40. Soup, fruit juice, and soft rice will also continue with saline. Rice saline can be served if necessary. How to prevent diarrhea? Always use pure boiled water or table water. Milk should be boiled perfectly. Food should be covered to protect from flies and insects. Avoid old and rotten food. Plates and glasses should be washed with pure water. After using toilet, hands should be washed with soap or ash. Foods brought from markets should be washed with pure water. We have to do all this to prevent diarrhea. Now come to lesson 3, cold, cough, influenza, and worm. Cold and cough. We are all acquainted with cold and cough. Many children are attacked of this disease mostly during seasons change. In summer, the source of these are dust and sweat. Things to be done: use handkerchief to or tissue, blurring with hot saline water. Plenty of fluid like saline, fruit juice, and others be taken. Take doctor's advice if necessary. Next, influenza. It is an airborne contagious viral disease. The symptoms come out within 18 to 72 hours of first attack. It stays 5 to 7 days for children and 3 to 5 days for adults to recover. The disease is accompanied by high fever with cold and cough, headache, muscle and throat pain. Now students, come to page number 41. Things to do in the time of influenza. Use handkerchief during sneezing and coughing. Cough and spitting everywhere which should be avoided. The affected child should be kept in a separate room. In high fever, heads should be washed with sponge of the body carefully. Soft and liquid food is the preferred diet. Cleanliness is necessary. Treatment should be continued according to doctor's advice. So we have to do all this during the time of influenza. Prevention: to wear proper dress according to change of season. In case of heels sweating in summer, the body needs to be wet to make it dry. Drinking pure water and other liquids in such cases. Exercise, rest and balanced food is necessary. Special care needs to be taken to avoid contagiousness. Crowds should be avoided and the use of mask is important. Worms live in the intestine as parasite. In our country, most of the children are victims of worms. This is a serious health problem for children. There are 3 types of worms: round worm, thread worm, and last one is hookworm. First, we'll learn about round worm. It is round shape, bigger in size, and looks like earthworm. The eggs of this worm enter into human body through green leafy vegetables and fruits. In case of worm attack, the following symptoms become expressive. The stomach is inflated, vomiting tendency, will loss of appetite, and weight loss is common among children. There is indigestion and physical weakness with stomach pain, malnutrition, and anemia. Next, number 2, thread worm. It is similar in size and looks like thread. The female worm lays eggs in the rectum. At the time of eating the rectum, these eggs enter the nails and spread all over. The symptoms are there is itching and the eggs are seen in the rectum. Now come to page number 42 and learn about hookworm. Barefooted children mainly have this type of worms. The eggs enter the body through skin and intestine and become big worms after. The symptom is anemia and the child looks pale. Ways to prevent: to stop toileting everywhere, use sanitary toilet. Hands should be washed with soap before meal and after using toilet. Raw foods should be washed before eating. Cold and old food needed to be avoided. Nails of hands should be kept small and clean. No barefooted movement. Everybody should take anti-worm medicine together as per physician's advice. So we have to take all these steps to prevent from worms. 3 kinds of worms: round worm, thread worm, and hookworm. Now we'll learn about lesson 4, measles, tuberculosis, poliomyelitis, and mumps. First, we'll learn about measles. This is a contagious viral disease. Anybody can be attacked by this, but mostly children under 5 years and the victims. The exposure time is 14 years. The symptoms are the following. At first, there is a cold attack with runny nose and eyes, headache, and swelling of face. Temperature rises up to 103 degrees Fahrenheit to 104 degrees Fahrenheit. After 3 to 4 days, rash comes out at the back of the ear and spreads all over the body and face. The whole body is covered with deep pink and red colored rashes. After 5 to 6 days, the color becomes lighter and the fever subsides. It takes 9 to 10 days for the rashes to get dry. The rash in the eye makes the eyelid swollen and red. Rash inside the throat is very painful for the baby to eat. After recovery from measles, children may attack of pneumonia, diarrhea, and malnutrition. Next, come to page number 43. Steps to be taken. We have to take this type of steps to prevent measles. The patient should be kept in a separate room. No one should enter except the nursing person. Before dealing with other people, nursing person should change his or her clothes and wash hands and face. Clothes and all utensils used by patients should be kept separate. To avoid complication, doctors should be consulted. Liquid food be served very frequently. The environment should be neat and clean. Now, prevention measures is taken. How should be avoided? The child needs to be vaccinated at the age of 9 months. Now we'll learn about tuberculosis. It is very dangerous contagious disease. The bacteria is called mycobacterial tuberculosis. The bacteria spreads through sneezing, coughing, and spitting. The symptoms are it starts with low-grade fever and cough, loss of appetite with weight loss, the child became weak. The affected gland enlarged with pain, long time dry cough coming out of cough with blood, raise of temperature at night and rapid pulse rate with tiredness. Now we'll go to page number 44. Tips to be taken. After the exposure of symptoms, immediate consultation with the doctor is necessary. Complete rest along with nutritious food is a separate room should be arranged. The room should have enough light and air. The patient's cough should be thrown at a fixed spot. All used materials should be separated and be neat and clean. Prevention. A dose of BCG vaccine after birth can save from miliary tuberculosis, poliomyelitis. Children of less than 10 years are mostly the victims. The incubation period is 7 to 10 days. Symptoms are cold, cough, and headache with slight temperature within 1 to 3 days. Headache increases after 3 to 5 days, and neck becomes stiff with the paralysis of hand or leg. The baby refuses to stand and cries in each attempt. The affected part gets weaker day by day with final crippling. If the virus attacks respiratory muscles, the baby can die also. Here you can see this type of baby. Things to be done. This is a very contagious disease, so the patient needs separate rooming immediately. Prevention. 4 doses of polio vaccine can protect from the disease. Mumps. It is a viral contagious disease. Children between the ages of 5 to 15 years are mostly affected by this. The exposure time is 2 to 3 weeks. Symptoms. It starts with fever. One or both sides of neck and ear is swollen, accompanied by pain which spreads in the mouth. Opening the mouth becomes difficult. Sometimes teeth, pincers, ovary, heat, eye and ear may be affected. Now come to page number 45. Things to do. Liquid food like milk, fruit juice and soap is ideal for the patient. Gargling with hot water, saline water is necessary. Doctors should be consulted. Now we'll learn about lesson 5, immunization, vaccine, injection. Prevention is better than cure. The EPI program of the Health Service of the Government of the People's Republic of Bangladesh is an important, remarkable and timely approach. It is a worldwide program and the main objective of it is to stop premature death and disability. That is why worldwide special attention is paid to prevent disease. Besides, prevention is easier and less expensive than treatment. The main objective of vaccination is to reduce infant and mental mortality. IMR and MMR in Bangladesh. Children of less than 1 year are more vulnerable. For this reason, all children need to have the required vaccine as early as possible. The following diseases can be prevented through EPI program. BCG vaccine. This vaccine is used for tuberculosis. After 2 weeks of vaccination, the place becomes red with swelling. After another 2 or 3 weeks, the place may be hard or spectic with wound. The wound subsides slowly, keeping the spot. This is applied after birth. OPV vaccine, oral polio vaccine. This vaccine prevents poliomyelitis. This is applied in 4 doses. The first dose starts within 4 weeks after birth, following the second one after 28 days, with the third one after 28 days. The final or the 4th dose is completed at the age of 9 months. Pentavalent vaccine. This is combination of 5 vaccines which covers diphtheria, whooping cough, tetanus, hepatitis B and Haemophilus influenza B. The first dose is applied 6 weeks after birth, following second and third dose after 28 days each consecutively. Vaccine for measles. This vaccine is applied after completion of 9 months. TT, tetanus toxin. This is a protection from tetanus all women from the age of 15 to 49 and children who had convulsion after DPT or pentavalent application need this vaccine. Students, that's all for today. Hope you have understood today's topic. Please read the text again and again at home. You have to complete your assignment. Very soon you will get the topic and you have to submit your assignment at school. That's all for today. Hope you have understood today's topic. Keep practicing at home and abide by your parents. Stay well and see you again. Till then, Allah Hafiz. Assalamu alaikum.